Please can you remind me, if you'll be so kind, staring out into space, asking God to hear my case.
Well, hi everyone, and welcome to Alzheimer Speaks Radio. We have a wonderful guest for you today, and we're going to be talking from an international level this afternoon. But before I introduce our guest, I just want to again thank our audience listeners. You guys have been absolutely fantastic in terms of spreading our reach. Your likes, your clicks, and shares have really made a significant difference in helping us shift dementia from crisis to comfort around the world, and we really, truly appreciate that so much. This is also World Alzheimer's Month, and so how appropriate to have somebody internationally with us with the World Dementia Council. Before I introduce Lenny and tell you a little bit more about him, I also want to share for those of you that are new to our show a little bit about me. I was not in this space up until 10 years ago. My mom actually lived with this disease for 30 years, and so did our family. And that motivated me to make a difference and step into this space and try to connect people to products, services, and tools, and just give hope that there can be a really good life with dementia. And I've been just so honored with all the people that I get to talk to around the world. And don't think for one second that I haven't been, down in the dumps and felt isolated and alone and frustrated and angry. I have, but I really was able to find another path of joy and purpose and passion and just living in the moment. And I found that dementia had so many wonderful gifts to give not only me, but I think everybody. So again, thank you for listening, and I hope that you will continue to like and click and share these episodes. I do want to give a shout out to the Memory Cafe directory. You can just go to memorycafedirectory.com, and there you will find a list of now in the U.S. over 750 memory cafes. And for those that are new and aren't for sure what that even is, it's basically a gathering of people with dementia, mid to early stages, and their care partners. So they really get to build a community because, as we know, many people walk away and feel uncomfortable when this disease hits. So they are absolutely fantastic. And I also want to give a shout out to stall catchers. In fact, I just talked with Pietro the other day, and they're probably going to be pulling together another megathon. And when that happens, I will let you know. Stall catchers is actually a game any of us can play to help analyze real life data that the researchers are working with. And it's a fun game. And so check it out. Just go to stallcatchers.com and you'll be able to find out a little bit more about that. And you can play the game anytime. You don't have to wait for a mega event to happen. And they have children as young as 6 and people as old as, I want to say, 92 playing the game. So it covers all generations, and it can be even a family game. You can set up teams and so forth. So with that, I am going to go ahead and introduce our guest today. We have Lenny Shallcross with us, and he is the director of, again, the World Dementia Council. And prior to that, he was head of community engagement, leading programs across the UK to establish dementia-friendly communities. This included Dementia Friends program, which is the biggest health social movement campaign delivered by 10,000 volunteers. And they have recruited 2 million individuals through the community and digitally and through their corporate offer. Which is absolutely incredible, pulling all these people together under the umbrella of Dementia Friends. And before working for the Alzheimer's Society, he worked in the UK government as a political advisor in the Department for Culture, Media, and Sport in the Department of Health as well, and has worked for Parliament and the Labour Party. So Lenny just has just a vast wealth of experience. So welcome to the show. How are you doing today, Lenny?
I'm good, thank you. It's an autumnal day here in London.
Yep, beginning of ours over here in the U.S. and stuff. So again, I really appreciate you taking the time. I know how busy you are. Now, before I get started with my line of questions, I always like to ask every guest if they have been personally touched in their own circle of family or friends by dementia.
Yeah, so dementia affects 1 in 3 people. So I, like most people, have a contact with people who live with dementia. So my great aunt had dementia, and my I'm actually not from London itself, but I'm trying to think of a equivalent in the US, but it's sort of sheep farming country in the hills of Wales, where everyone knows everyone else. It's a small farming community. So when somebody gets dementia there, everyone knows. And this rural town has established a dementia-friendly initiative that's helped raise awareness and support so that people are able to feel part of the community that they are in.
Wonderful. Thank you. Now, you're the director of the World Dementia Council. What drew you to the job, and then what exactly does the World Dementia Council do?
So the World Dementia Council was set up by the G8 following a dementia summit that was held in London in 2013 by the then UK Prime Minister David Cameron. And the G8 is the gathering of the world's leading economic countries. So the United States is a member, as is countries like France, Germany, Japan, and the United Kingdom. And the thinking behind it was that no one country, no one organisation, no one individual is going to be able to solve the dementia challenge. It's not just a challenge about research, it's a challenge about improving care that people have today and improving people's lived experience within the community. And to deliver on those goals requires international collaboration. So David Cameron's government in 2013 recognised the need to have much more international coordination. They held a summit that committed to deliver changes in people's lives and in the research agenda by 2025, and to support and challenge the international community to deliver on those goals. After the summit, the UK government led an effort to establish the World Dementia Council.
Well, that's exciting. We here in the US are kind of running behind your tail, I guess, in terms of trying to implement some of the things. We've learned so much from other countries, and that's been one of the things for us to kind of get over ourselves, that we're not always ahead, we're not always the first. And that's been really surprising for a lot of people, living here in the U.S. So it's to me, it's been so exciting just in the 10 years that I've been in this space to see the difference in terms of collaboration here in our country, which I thank to your country and so many others of kind of showing us the way. And I personally believe that dementia is here to almost force us to be collaborative here in the U.S. and around the world, and we can learn so much from one another. I think it's a beautiful, beautiful goal. And again, thank David Cameron for pulling that together and spearheading that, and for you to step into the role. What kind of pulled you into this role, enticed you into it? Was it personal experience, or was it just the overwhelming and enriching goal of what it was?
Well, dementia is the biggest health challenge that the 21st century faces. It is, and there's no other suitable word for it, an epidemic. If you look at the number of people who are living with dementia today, and you compare that to how many people will be living with dementia in 2050, then our health and social care systems, Medicare in the US, like the National Health Service in the UK, is just not set up to deal with that kind of challenge. And in the 1970s, Nixon declared a war against cancer. In the 1980s, they declared a war against HIV. We have to face what is the 21st century's biggest health challenge. And that's about investing in research, it's about improving care, and it's about improving the lives of people who are living in the community. And so I think that if you are looking for a challenge and you're looking for an interesting and exciting area to work in, then it's the dementia area. And I use the word exciting deliberately because one of the things that I think it's important, and many of your listeners will know this, but it's often overlooked, is that the story of dementia over the last 10, 15 years is a story of progress. We know more about the science than we have ever known before. We know more about what good care looks like than we have ever known before. Dementia is more visible, it's talked about, and you're seeing people being included in the society in a way that they weren't. There are huge challenges, and when you look at the kind of numbers that we face over the next 20, 30 years, you can see that we need to do a lot more, but the story is one of progress and of hope and opportunity. And that's why this area is so interesting.
I totally agree. I have seen such great changes in terms of awareness, in terms of people feeling comfortable telling their stories so that we can learn so much from one another. I mean, from things in print and on the news, on the radio, plays, music. I mean, it's coming out in all different angles now. And to me, also one of the things that is most exciting is the creativity. That, hey, we might as well try it. We don't know if it's going to work, but we have nothing to lose, but we have everything to gain. And seeing the intergenerational efforts too coming into play and pulling more of a sense of community. I think I don't know in other countries, but I think here in the US we have kind of divided and separated, and we've gotten away from our sense of community and helping one another because our lifestyles are really busy, and I'm seeing people drawn back to thinking bigger than themselves, and that just makes my heart happy, to see that happen. And so I think there's a ton of hope out there, and to me that's very exciting. Can you tell us a little bit more, because some people might not know about the Dementia Friends project? Do you mind just telling people a little bit about that, and then we'll get into your project at looking at dementia-friendly communities as a whole?
So Dementia Friends began as a project in Japan, actually, at the start of this decade, and it was aimed at supporting people who live with dementia in the community. And it's a program that's recruited about 9 million Japanese people to increase their awareness and to increase the support that people with dementia have in the community. This was copied by Alzheimer's Society in the UK, that established the Dementia Friends programme in England, Wales and Northern Ireland. The setup of the United Kingdom is slightly complicated, so that if something is done in England, it's not necessarily done throughout the UK, but it's being covered in England, Wales and Northern Ireland under the Dementia Friends identity, and this has been copied by around 40 countries around the world, and there are Dementia Friends initiatives in the United States. And I think part of the aim of programs like this and other programs is to raise awareness of the issue and encourage individuals to take action. And I think something you said, which is very important, is that this isn't the only way to raise awareness and understanding of dementia. In the UK, you can see the impact that television has, and you see it on every aspect of our lives, that when lifestyles are accurately represented in TV dramas, in films, and in the public space, then that does change attitudes. And what you have seen in dementia over the last couple of decades is more and more that the lifestyle is represented in the public space. And this is really important because it's where most of us get our knowledge and information from. And this shift, which you have seen over the last decade, has really begun because people who are affected by the condition are themselves speaking out. So you go back 20, 30, 40 years, people didn't say that they had cancer. It was something that wasn't really talked about. It was something you kept quiet. You didn't share with your family. You certainly didn't share it with your neighbours. And what happened slowly over time was more and more people said, I have cancer. And in many ways, you are seeing dementia on the same trajectory that 20, 30 years ago, it was never talked about. It was something to be embarrassed about. It was something hidden away. And hidden away, people wouldn't tell their children. People certainly wouldn't tell the extended family. And you certainly didn't let your neighbours know. And that has changed. And because that has changed, then you are seeing dementia represented in the media. You are seeing it represented in film. You are seeing it represented in novels. And Dementia Friends is just one of these examples of how society is changing. So whether we celebrate people going on memory walks, or we celebrate them becoming dementia friends, or celebrate them talking about it on TV or on radio, it began because people were willing to tell their own story about what it was like to live with dementia.
I would agree with that, but I also think it was elevated because people were touched by somebody. Like you said, 1 in 3. And here in the U.S., they still don't use that statistic. That's the, when I go speak, that's the one statistic I give out, because people have to realize how broad this thing is, and that there probably are people in their own circle that they don't even know are dealing with it, and to be able to have that conversation. But I think with the news, anyways, what I've seen over here, I think a lot of people personally have been touched with it. And so then they've taken their skill set and said, hey, let's do a story on this. Because they're learning along the way too. And so, but again, it's opening that door to that comfort zone, because it really was kind of a taboo box that nobody opened up.
And what you see is politicians in the US, in the UK and elsewhere are doing a lot more about dementia because the public are talking about dementia and they're wanting solutions. So for example, in the US, you have seen a huge increase in research funding that has gone from about $500 million 4 or 5 years ago to $2.4 billion today. In Europe, you have seen Horizon funding and the establishment of IMI. In Japan, you see AMED as being established as a research institute. And this has become about because the public is saying to decision makers, we want solutions to what is the biggest health challenge of the 21st century. So as a consequence of speaking out, yes, people are included much more in the community. Yes, they are looking at how facilities are set up to include people, are there support groups, are there memory cafes, such as you mentioned, but equally saying to governments, you need to fund research. You need to fund research not just into better treatments, but to disease-modifying treatments, and also to better care, because we need to understand how to deliver care in a way that is beneficial for someone with dementia. And the other big challenge that we shouldn't forget is support for the caregiver. Dementia is never a journey that you face alone. It always involves a family. It always involves neighbours. This is not a disease where support is not needed. We are talking about a neurodegenerative disease. And for many caregivers, this is one of the hardest things that they will deal with in their life. It's emotionally challenging, it's physically challenging. And if you want to look after the person with dementia, you need to look after their care partner. And those two things together will help people lead better lives.
Oh, I totally agree. And I love that care has, almost caught up to cure in terms of balance, because I do believe that that's a a huge factor. Here in the U.S., it's stated over and over again that this could bankrupt us if we don't get a handle on this, if we don't get support into the communities. And one of the ways I think that is so supportive is, again, just in people sharing stories, just feeling not isolated anymore is so critical. And then for, like you said, those with dementia having a voice. I mean, I love the videos and the features that are done, or people speaking at conferences. To me, it's always been asinine, why would you not include the patients? They're the ones living with the disease. They know it best, and their care partners. And yet we, and again, I'll speak from the U.S. perspective, we've always come from, this aspect, well, the doctors know best. And, we're seeing a big change in terms of movement in terms of educating our medical professionals. And even our college students going into school are getting involved in that process, which I know is happening all over. And I think that is fantastic. And the ability in these past few years of just changing the face of dementia. I know when I stepped in, like I said, about 10 years ago, the face of dementia was still perceived here in the U.S. as an elderly person, end of life. Couldn't talk, couldn't walk, wheelchair bound, had to be fed. And it was like, once that is changed and people realize this could hit anybody, and even some children are now getting diagnosed with it, that just changes, I think, the interest level in multiple ways. And it's sad to say, but I that's what I've seen here in the U.S. I don't know if you've seen that in other countries as well or not.
Well, I think you're absolutely right about the involvement of people with dementia, because there's a phrase that's used in the UK. I'm not sure if it's crossed to the US, but it's nothing without me, nothing about me without me. And it's a relatively simple concept, but at its heart is that the person who is affected by the condition is the person who is able to say what's important about their life and about their future. And the challenge is always, you ask one person, well, say this, and when you ask another person, and they'll say this. But step back from any one person's individual comments, and you get three broad things that people want, which is research. Even if treatments are not going to benefit you, what's incredible is so many people with dementia are willing to be part of clinical trials and research studies that is enabling us to know more about the disease and ultimately to find treatments in the future. And we should recognise and acknowledge that the people with the condition and their caregivers are doing an astonishing job in their willingness to be part of these trials. The second is that people continue to talk about the importance of support in the community, support for someone with dementia, and support for their caregivers. And as you mentioned at the top of the programme, memory cafes are something that you see in the US, but you see across Europe and beyond. And that's because when you have a condition like dementia, and I use the word condition because dementia describes a range of different diseases, the most common of which is Alzheimer's disease, but there are lots of other forms like vascular dementia, early onset dementia, dementia with Lewy body, and so on. So if you look at a condition like dementia, where there are currently no treatments that will stop or slow the condition, what people want after a diagnosis is support and advice, and often they want to connect with people who are going through a similar experience. And that's why services that connect people affected by the disease and support their caregiver is so important. And then the other thing that people have continued to say who have the disease is that for as long as they can, they want to get on with their life. dementia is not a label that defines you. After a diagnosis of dementia, you have as much right to participate in society as you did before you were told by your physician that you have dementia. And that means that you can carry on participating in hobbies and in clubs, going to the restaurant, taking up new hobbies, going on a holiday, driving your car. All of these things are perfectly possible, things that we take for granted, but someone with dementia encounters obstacles to be able to do. So, for example, something as basic as a driving license, it should never be automatic that you lose your driving license if you have a diagnosis of dementia. In large parts of the world, that still remains the case. But we know that you can carry on driving as long as you are medically able to. So when you have a diagnosis of dementia, you should have as much right to participate and be included in society as before you had that diagnosis.
I totally agree. You had mentioned research and support. Was there a third one, or did I miss it?
The right to participate in society.
The right to participate. Okay. I wasn't sure if that was kind of combined in there.
People want research, but people want to get on with their life. You know, when you have any illness, you still want to be able to see your friends and your family, and you don't want somebody turning around every 2 minutes saying, "How are you? What's going on?" You are still the same person. Dementia is a huge challenge for anyone who is going through this. It is an unpleasant condition that is a neurodegenerative condition that we cannot treat. However, after a diagnosis, everything doesn't stop. You shouldn't lose friends and family. You should still be able to carry on with the hobbies that you take up. And what research shows is that people with dementia often actually lose touch with friends and family. They stop taking up hobbies. They're reluctant to participate in society. And that's one of the things that we have to change. So research, better care and support for caregivers, and ensuring that people can continue to participate in society.
Yeah, I agree with those. I would add a fourth, and that is ease of access to resources. I know here in the U.S., actually, I'm working with a company that is in the process of putting together kind of a dementia resource that's absolutely fabulous, but they need, and they've been working on it for about, 3 years now. They need a little bit more funding, but 35 years ago when I first got involved with this, when my mom was diagnosed, that was one of the most frustrating things, was how do you find what you're looking for? And you can go to Google, and most people do after a diagnosis, and it scares them a lot, though there's better information out there kind of giving a more positive view. But I think ease of resources is critical to help families reduce stress as well. Here in the U.S., we are still kind of fighting and promoting with our medical professionals to give resources upon diagnosis, and typically it's still, for the most part, here's your diagnosis, here's another appointment, maybe a medication, and if they're lucky, they'll get a number to the Alzheimer's Association, and that's pretty much it in most clinics. And again, when I talk with people around the world, I hear that that's still fairly common. So I think that resource piece is a huge need. The other thing is with the research, and I think it's gotten better, but I still hear a lot of complaints about ease of access, or there's a lot of people willing to participate, but because research has to kind of funnel down, they get booted out, and they get a little down on that because they want to know how to be able to participate. And the support groups, I think, is critical, that acceptance of, being able to live in your community and still feel engaged, and that ability to participate as a person, as a citizen, and still have rights and respect. And again, I think a lot of that is changing between things like the Dementia Friends and dementia-friendly communities, and just the ability to have more education. I have to say the BBC has done some just brilliant pieces that, are shared all over the world, which I'm sure and, to me have really helped lead the way in terms of breaking some of the syndromes and the stigmas down from the media. Many times, I know for myself, I still get approached of, talk to us about how bad it is. Woe is me. And even for the longest day, I was approached and I said, I don't want to focus on it being, it's the longest day, because you have a lot of time. Let's utilize it. Let's appreciate it. Let's find joy. So I think, we're hearing more about those connections and people slowing down and appreciating the smaller things of life and the gifts that come wrapped in a really strange package, called dementia, that can make our lives better on so many levels. Why don't we talk about Dementia Friendly Communities project that you're working on in the survey, if you don't mind sharing that with our audience?
So one of the things that you see since 2013, and you alluded to earlier in the programme, is that there are a lot more dementia-friendly communities around the world. And these vary considerably, right? Some have been set up by individuals, some by local government, some by not-for-profit organisations. Some have been actually led by national governments. In the United Kingdom, there's been a target set by the Prime Minister's Challenge on Dementia to include 3/4 of local governments having dementia-friendly initiatives. So what you see is a huge growth in initiatives around the world. The second thing that you see is huge variation in these initiatives. If you look at, say, what's happening in the United States, you look at what's happening in Japan, you look at what's happening in the UK, you see very different types of projects. And even within countries, you see very different types of projects. Some things sit under the label dementia-friendly initiative or dementia-friendly program, would in another country sit under the label of health and social care program. Now, all of these programs have a common aim, which is to improve the lives of people with dementia. So we know that people with dementia need support to live in the community. And these initiatives have really grown up because people want to include them and to support them. Now, what we need to understand is the evidence that underpins this. Are we able to show how these initiatives result in people leading and living better lives, healthier lives, staying out of hospital, delayed admissions to institutionalized care? Because for these programs to deliver on their ambition, they have to make people's lives better. They have to make people feel more included in society. And we have to be able to show how that happens. And it's partly because when you look at, say, the support, giving support to caregivers, we're able to demonstrate how, if you support caregivers, you reduce the number of people admitted to institutionalized care. And so it's very important that these great initiatives that have grown up since 2013 are able to show how they're benefiting people's lives. And so the purpose of this project that we are doing, along with Alzheimer's Society in the UK, AARP in the US, HGPI in Japan, Alzheimer's Disease International, and with the support of the World Health Organization, is to gather the evidence from people delivering the projects, from academics, from people working in dementia, and from people who are working in aging, to gather evidence on what these initiatives are, how they've been set up and how they are working, and what the evidence is on their impact. So at the moment, we are running a global survey. We've already had responses from every bit of the world, which reflects quite how widespread and diverse these programs are. But what we want to do is hear from as many people who are delivering these projects, who have experienced these projects, who've researched these projects, to understand what's happening and what the evidence is on the impact of these projects.
I think one of the things too, and I don't know if this will come out of the survey results, but there's a lot of people, like for myself, I'm not an academic. I wouldn't even begin to know how to set up a survey to pull together research and stuff. But if I'm sure a lot of things I'm involved in, we could gather that if we knew what to do, and how to gather it. I mean, I've seen some simple surveys done, kind of before and after, measuring, just even emotions and things like that. I don't know, and I know others go greatly in depth. We're doing one now in Minnesota on dementia travel, with airports that just closed out. That's, is very extensive. So if there were simple things that people like me, because I think there's a lot of people like me around that are doing initiatives but don't know how to do the research, don't have access to the funding to do it. I mean, we talked offline about this a little bit before. In the US here, it was hard enough to pull things together, to get a project together, let alone to get money for research pulled together. Is that something that might be able to be shared so that more information could be gathered?
Well, part of doing a global evidence gathering project like this is that you're able to say where in the world research has been done and what it's found out. Because to some extent, there are certain things that you don't necessarily need to evidence. Because if you take something like supporting someone with dementia at an airport, now, I think that's just about including somebody. And we wouldn't say if you had a physical disability that required you to be in a wheelchair, show me the evidence that the wheelchair ramp at the airport leads to better outcomes. We just accept that the wheelchair ramp is about inclusion. Now, for somebody with dementia at an airport, they might need extra help to get through an airport. It's a busy, distracting environment, and there's plenty of evidence that shows that that's a particular challenge for someone with dementia. People with dementia tend to like clearly identified quiet spaces. Signage is really important. I unsurprisingly travel a lot for work. I find airports very difficult, confusing places. So for someone with dementia, they can be incredibly difficult. So you don't necessarily need to demonstrate evidence for a project like that, because including someone in society and enabling them to participate is a right in itself. So if you look at the airports within the UK, Heathrow Airport, which is the biggest airport here in the UK and is a major international hub, has delivered training to a large number of its staff, from security guards to the people who check you in and take your baggage, and to ensure that they are aware of dementia. Now, I think that results in people being included. And I'm never going to argue against inclusion. So when we talk about evidence for different types of activities, we're talking about very different lots of evidence. And this was one of the things that's already coming out in the survey that we're doing, and will continue to come out, I'm sure, as more responses come in, is that sort of project is very different from, say, a project that's aiming to raise public awareness, when you can actually look and go, is the public more aware after this project or before this project? So that you would look at and say, evidence is important because we want more people to be aware over time. We need to show that this initiative works. But I think there's a lot, and it's perhaps often given the label dementia friendly, when actually it's just about treating people decently. and including them. And I think, and it goes back to something I said earlier, but when you are told you have dementia, you have as much right to participate in society for as long as you are physically able to do so before you were told you have dementia and after you were told you have dementia. Now, to enable people to participate requires airports to appropriately train their staff. It requires first responders to appropriately train their staff. There was an example I was reading about recently, how in Austria, over 2,000 police officers have received training in around some of the behavioural disturbances that are associated with dementia, so that when they come across it, they know how to respond appropriately. Now, all of these sorts of things, the airports, the first responders, seem to me to be just the right thing to do. And when we are gathering evidence around what these projects are and how they've worked, we're gathering evidence that about projects like that are just the right sort of things to do. Projects that have been raising awareness, projects about how individuals are trying to change their community, to change perceptions in the community about dementia. So there's lots and lots and lots of different types of evidence, and there are lots and lots of different types of projects. And I think that is one of the challenges in this space, is something I said at the start, which is people describe almost anything as dementia friendly. Now, what needs to happen is that people are included in society. That's the prize. Included on their own terms, able to participate, able to live the life that they choose for as long as they're able. That is what we are aiming for. And that requires organisations and individuals supporting people with dementia to be included, support for caregivers, support for things like memory cafes, and better research. Get all those things together and you will have more people living well with dementia, which is what our goal is, while we look for treatments that will ultimately slow the trajectory of this disease and in the long term deliver cures.
Oh, I so agree. One of the, and I didn't know if I should try to fill out the survey or not. I do a thing called Dementia Chats where I interview people with dementia, and they say over and over, and again, we don't have any data other than, their comments of how fulfilled they feel and how respected they feel to have their voice, be heard, or when people are heard at conferences and things like that. I mean, it's just such a huge piece for people. I think this is going to be a real exciting project. I know in the U.S., when we kicked off the first dementia-friendly community, we had people come from about 7 counties out saying, how are you doing this? And it's like, we're just starting, and I'm a grassroots girl, as you can tell. And people were just shocked. They're like, well, we've been working on this for, 2 years and we don't have a mission statement yet. And I'm like, kick the mission statement to the curb and just start trying, align with like-minded people and more will come. People get so excited to see new things and to believe that it can happen. But I know here in the US, sometimes we just get tangled up in our bureaucracy and thinking it has to be perfect. And to me, if dementia's taught me anything, it's like, life wasn't perfect before it. It's not going to be in the future, and it's not while it exists. And it's all about adapting. And that's exactly what you're talking about, is having society adapt. What's good for dementia is good for, health and social services. It's good for age-friendly communities, which is kind of a battle here in the U.S. between what are we going to call this? And I also think that it's really important for us to include the kids. I used to go in and teach at the schools, and I haven't done this for ages, but I would go in and talk about dementia and ageism. And I would be in the middle and high school, and it was amazing how many children were caring for a loved one with dementia, but they didn't know what was going on. And they all just kept saying, we want to help, but no one tells us what's really going on. But they're feeling the shift in the family dynamics. They know they're not necessarily the priority that they once were. And so I just personally believe in having these authentic, open conversations gains us so much ground and alleviates the isolation, which, hits so many people, and that we can learn from one another. What are your hopes? How long is the survey open for, and what are your hopes to gain from the survey?
The survey is open until mid-October. What we hope to hear from the survey is what's happening in different places around the world, as you said, around not just dementia, but also age, because there's considerable overlap. So, but what we're able to do is begin to pull together a global evidence synthesis so that we can make recommendations to funders, to governments, to not-for-profits around how you develop these initiatives and programs over time.
Wonderful. Now, to get a hold of the survey, they can just go to the World Dementia Council.org website to get that information. And actually, I'll have a specific list that'll get their link that'll get them right to that. And you've loaded it so they can either download a PDF or a Word document and complete and resubmit. I know I blasted it out to a ton of people around here, and I have to tell you, I got so many letters of gratitude thanking me, going, this is such important work, and we're thrilled to be part of this. So I don't know if you realize how many people appreciate what it is you're doing all around it, and the importance. I mean, they feel this need to come together and to share. And sometimes when you're in the midst of doing something, you just don't know how to connect. How do you reach other people? So it's wonderful that your organization exists to help pull us all together with this and gather this information. Once the survey closes, you're going to have to sort through all this data. Do you have an idea of when you would have a report ready, and will you share that with everyone, or will it just be bits and pieces?
So we're aiming to launch a report in February next year. So alongside this bit of evidence gathering, we're also conducting a literature review to look at what academic reports have already been published and what evidence has been gathered in other bits around the world, looking at different initiatives associated both with dementia friendliness and with age friendly, and also more broadly looking at the academic thinking around how you create inclusive societies. So this is just one bit of the work that we are doing over the next 12 months, and it all has this broad aim that what we need to do is develop better treatments. So there are already a few drugs on the market that are symptomatic drugs, but we need treatments that will stop or slow the development of dementia. And that is, I think, on track, because what you're seeing is a lot more investment from governments and not-for-profits in dementia research. What you need is better support for caregivers and for people who are living with dementia. And what you need is to support people to be able to be part of society. So do those things and people will lead better lives. And that's the broad aim of what the World Dementia Council tries to do, but the broad dementia community around the world. Success is more people living well with dementia.
Do you see under that umbrella, because I hear this, all over the place when I travel, we're having a really hard time finding staff for memory care, assisted living, the whole 9 yards. But for people just even to work, because it's not a lot of places don't feel it's a livable wage. Do you see that coming into play at all with any of the work that you're doing?
So a lot of countries around the world face a challenge of recruiting and retaining people working in care, not just in the dementia space actually, but in care more broadly. And it tends to be that somebody who delivers care is not particularly well paid and has very limited training for what is a very stressful and challenging job. So you see a lot of vacancies and you see a lot of staff turnover. And actually, often nothing is worse for someone with dementia than seeing the person who is coming in to support them change every few weeks, because that's something more difficult to manage if you have a neurodegenerative condition than if you don't. Now, a lot of those challenges are to do with the funding that is available for social care and for long hospital care. And you see in the US, you see in the UK, and you see elsewhere that people make significant out-of-pocket contributions towards the cost of care. Fundamentally, dementia is a descriptor of a number of different diseases. This is not caused by some random act. This is not some accident that you've encountered. It's a disease just like cancer. And I think one of the challenges is that it shouldn't be a lottery what kind of care and support you get. And fundamentally, governments at a federal level or at a state level in the US, or governments around the world as well, need to ensure that people get care and they get good quality care. Now, the Organization for Economic Cooperation and Development, that is based in Paris, published a report last year that looked at care across 25 high-income countries who responded to a data gathering exercise that they did. And what they found was that care was inconsistent, was often of a poor quality or an inconsistent quality, and it led to bad health outcomes for people with dementia. If you deliver poor care, somebody is much more likely to end up in an emergency unit, being treated because of a fall or dehydration, or because of carer stress, and they're much more likely to end up in institutionalized care. That is not a good outcome. So one of the key challenges, which I mentioned before, is to support someone with dementia and to support caregivers and to ensure that it's adequately funded, because if you don't fund it, it is not going to happen.
Yeah, I think there's a respect issue here too with a lot of our carers, where they're kind of low on the totem pole in terms of space and in terms of voice in many of the situations, if it's a care community or if it's a family member. And I don't know how to correct that, but I think when people feel valued, when they feel their voice is heard, to me, that's when everything changes. And if that's a person with dementia, or if that's a person who's caring for them, I think that's where we get creative and authentic and, to the heart of the matter. And so, I know here in the US, I think that that's something that we have to look at, and, we need to value one another. And I think we've lost that in many ways. Now, as far as the project goes, who, with this survey, who would be kind of the key people that you'd like to come, and just so we can summarize that again, come and take that survey, Lenny?
So you would be somebody who is involved in a dementia-friendly project, so you're delivering it on the ground, or you would be an academic who is researching this area, or you would be working in a public body that's funding or is delivering these types of services. So if you're involved, tell your story about your experience of delivering these projects and the impact that they are having.
So it doesn't have to necessarily be total research based. You want the stories of what's being done out there you're gathering as well.
Exactly. So we asked questions in the survey around the steps that people took to set up their project, whether people with dementia were involved, what they're trying to achieve, what impact they think it's had. So it's about people who are delivering projects. It's about people who are researching into these projects. So if you're involved, tell your story about it.
Wonderful. I think that clarifies that a lot, and will make people feel more comfortable stepping up. I think sometimes when there's a survey, people get a little bit nervous and, it's going to be more than I can handle, and all of those types of things. About, do you have a time frame as far as, how long the survey is, or really does it depend on how much storytelling and how deep somebody dives into what it is they're doing?
It depends on the story that you want to tell. It could take you 5-10 minutes, or it could take you longer. And judging by the responses that we've got, some people have told their story and told a lot about their story. Some people have summarized their story, and both of those are great. So what we would say to people is, if you were involved, tell the story in a way that you are comfortable with telling it.
So because it's subjective on a lot of levels, how do you sort through all that?
So we have a research framework that we've spoken and agreed with the academic advisors who are working on this project, and that will collate the information in different ways to enable it to be analysed. So it's a fairly standard research mechanism that runs alongside surveys like this. So at the outset, we said, how would we analyse the responses that we get in? So that when we've got them, we're putting them into this system or process to analyse them, and then we'll use that to develop recommendations around what we know is working around the world, where we can see evidence gaps and challenges for the future.
Wonderful. Well, again, Lenny, I can't thank you enough for spending time with us. I think this is really exciting, and I think it's going to make a big difference in the world. And I can't wait for the report to come out in February. Is that going to be like through a conference, or how will that be dispersed initially?
Well, we will certainly launch it at an event either in the US or in Europe. We're currently looking at where that might be, and we will then disseminate it through our network of governments, not-for-profits, and put it on our website and ensure that people are able to hear about what has worked and hear about where we need to gather more evidence around these projects, because what has brought people from around the world into the dementia movement is a desire to ensure that more people live well in the community and are able to participate. And that's the prize for all of us as we work through research to discover treatments, as we improve the lives of caregivers and provide more support for people with dementia. We need to ensure that people who are living with dementia are able to participate in their community. And what we hope to do through a project like this is to gather evidence around where we are able to demonstrate the value and impact of these projects so that they can be copied and replicated elsewhere, and we can share our learnings and ensure that more people live well for longer.
Wonderful. Again, you can go to World Dementia Council.org. That's worlddementiacouncil.org. Or if you'd like to email them directly, go to info@worlddementiacouncil.org. Lenny, one last question. People who participate, are you gathering their contact information as well? So would a report go out to them, or is this all kind of anonymous?
So you have the option of leaving your contact details. For those of you who follow the intricacies of European Union regulations around the collecting and sharing of data. If you opt in to being told about the project and it's that the report has launched, we will certainly tell you about it, but you have to actively leave your contact details. The use of data is a lot more regulated in Europe than it is in the US, but I suspect that's a topic for another time.
Well, and it's all starting to change over here too. So, but I thought I would just throw that out for people so that they know. Again, thank you for the work that you're doing, and be excited to see the results.
Thank you.
Hi, this is Suzanne Newman, host of the Answers for Elders podcast and radio show. We are the North Star that guides you through the complicated journey of senior care with trusted experts in money, law, living solutions, and more. So join us on this station, your favorite podcast channel, or just go to answersforelders.com. Meet the Wayshowers who will help your journey go a lot easier.